In the last video, we have learned what is the definition of hypertension, what is the definition according to the international bodies, some uncommon forms of hypertension, and what are the causes of hypertension. Now we will learn what is the effect of hypertension on various body parts and what are the symptoms and signs we will get in a patient in whom we are suspecting to be having an hypertension. Pathologic consequences of hypertension. The first one is cardiovascular system. Heart disease is the most common cause of death in hypertensive patients. And hypertensive heart disease is the result of structural and functional adaptation leading to left ventricular hypertrophy, increased atrial size, congestive heart failure, atherosclerotic coronary artery disease, microvascular disease, and lastly, cardiac arrhythmias including atrial fibrillation. Congestive heart failure may be related to systolic dysfunction as well as diastolic dysfunction or both. Diastolic dysfunction is an early consequence of hypertension-related heart disease and is by left ventricular hypertrophy and ischemia. Second system is brain or central nervous system. Stroke is the second most frequent cause of death in the world. Elevated blood pressure is the strongest risk factor for stroke, and around 85% strokes are due to infarction, and the remainder are due to either intracerebral or subarachnoid hemorrhage. Hypertension is also associated with impaired cognition in an aging persons. Hypertension is associated with beta amyloid deposition, which is a major pathologic factor in dementia. In case of malignant hypertension, encephalopathy, that is hypertensive encephalopathy, is related to failure of autoregulation of cerebral blood flow at an upper pressure limit, that is 180 by 120, resulting in vasodilation and hyperperfusion. And therefore, the patient can present with severe headache, nausea, vomiting, projectile in nature, focal neurological signs, and altered sensorium. If left untreated, it may progress to stupor, coma, seizures, and death within hours. The four most common sites of hypertensive bleed are cerebellum, thalamus, basal ganglia, and pons. The third most vital organ is kidney. Hypertension is a risk factor for renal injury and end-stage renal disease. Renal risk appears to be more closely related to systolic than to diastolic blood pressure. Atherosclerotic hypertension-related vascular lesions in the kidney primarily affect preglomerular arterioles, resulting in ischemic changes in the glomeruli and postglomeruli structures. Progressive renal injury, there is a loss of autoregulation of renal blood flow, resulting in a lower blood pressure threshold for renal damage and a steeper slope between blood pressure and renal damage. This creates a vicious cycle of renal damage and nephron loss, leading to more severe hypertension by glomerular hyperfiltration and further renal damage. Typically, micro and macroalbuminuria are the early markers of renal injury. Now, the effect of hypertension on retinal blood vessels. On fundus examination, we find that there are changes in arteries and veins in the retina secondary to chronic hypertension. And this has been classified by Keith Wagner into four gradings: grade 1, 2, 3, and 4. In Keith Wagner classification, grade 1 is mild generalized attenuation, grade 2 is deflection of veins at arteriovenous crossing, that is AV nicking, plus marked generalized arterial attenuation. Grade 3 is grade 2 plus copper wire plus cotton wool spots plus flame shade hemorrhages and heart exudates. And grade 4 is grade 3 plus silver wire plus papilledema. Sudden rise of blood pressure can also lead to rupture of blood vessels, leading to sudden blindness. Now in this section we will be discussing about the symptoms due to elevated blood pressure. Now the clinical features may be due to elevated blood pressure itself, it may be due to target organ involvement or due to underlying disease as in secondary hypertension. The first one is symptoms due to hypertension. Headache, sar dard. This usually occurs in the morning hours, throbbing in nature and usually frontal in sight. Dizziness and epistaxis. Epistaxis usually occurs due to increased blood pressure causing the rupture of capillaries in the nose. The bleeding would reduce the circulating volume and lowers the BP, a natural way of lowering the blood pressure and prevention of hemorrhage in the vital organs. Now symptoms due to affection of target organs. Target organs के डैमेज की वजह से symptoms. The first one is cardiovascular. So due to left ventricular failure, we can get dyspnea on exertion. Due to ischemic heart disease, we can get anginal chest pain and palpitations. In kidneys, we can get hematuria, nocturia and polyuria. In CNS, TIA, that is transient ischemic attacks with focal neurological deficit. Second is hypertensive encephalopathy, जो हमने बात कर लिया है जिसके बारे में. Dizziness, tinnitus and syncope. In case of retina, we can get blurred vision or sudden blindness. Symptoms due to underlying diseases. For example, in case of acute nephritis, we will get edema and swelling over the face. In case of Cushing syndrome, we can get weight gain, hirsutism and strias. In case of hyperthyroidism or pheochromocytoma, we will get weight loss, tremors, palpitations and sweating. In case of primary hyperaldosteronism, weakness is a predominant symptom. Joint pain, bronchospasm and peripheral vascular disease symptoms may occur or will be seen in polyarthritis nodosa. Now let us see what are the signs we can get in a patient of hypertension. Moon face, buffalo hump and truncal obesity can be seen if a patient is having Cushing syndrome. In case of myxedema, we can get puffy face, rough skin and obesity. In case of hyperthyroid patient, we can get tremors, tachycardia, exophthalmos, thyroid dermopathy and goiter. In case of acromegaly, we can get prognathism, clubbed hand and other cause features. Neurofibromatosis, pigmentation will be the sign. In case of coarctation of aorta, we will get radiofemoral delay and collateral vessels over the chest wall. In case of preductal coarctation, we can get weaker left radial. And in case of aortic incompetence, a water hammer pulse. On cardiovascular examination, we will get cardiomegaly, third and fourth heart sound, loud second heart sound, and an early diastolic murmur due to aortic incompetence. In case of respiratory system, we can get basal crepitations due to left ventricular failure and rhonchi in case of polyarthritis nodosa as well as left ventricular failure. Abdominal examination. On abdomen examination, we will get hepatomegaly in case of cardiac failure patients. We can get palpable kidney lump in case of polycystic kidney disease or hypernephroma. Bruit over renal artery is an important sign in case of renal artery stenosis. And bruit over abdominal aorta is an important sign in abdominal aortic aneurysm. So we have learned in this video the effect of hypertension on various body organs, symptoms and signs of hypertension. In next video we will learn how to investigate and treat a patient of hypertension.